Joe Rhinewine here again, psychologist, psychotherapist. Last video, I started telling you about acceptance and commitment therapy, which is generally referred to as ACT for short. And I gave the example of my making these videos for the first time and the discomfort that I'm feeling at this very moment while I do this thing that I want to do. I'm going to say a little bit more now about why I'm doing this in a way that maybe you can generalize to your own life. And this is, broadly speaking, the topic of values. And in acceptance and commitment therapy, it would deal with the C, the commitment. Whereas in the last video I talked very briefly about the A, the acceptance. So I have a value to communicate and to express myself to the world. There are some other values that I have that are related to help others, to amuse others perhaps, and so forth. These tend to be in the infinitive, to do something. They're not so easily crossed off a list like goals. My goal in this case is to complete a series of videos that is reasonably articulate in explaining ACT, my primary theoretical model as a psychologist. So I'm working on that goal at this very moment. And that's the commitment piece, that I am persisting with this behavior of talking at my computer with the presumption that some human beings will eventually watch this and perhaps benefit from it or at least be amused by it. And I'm doing so despite the fact that it makes me a little uncomfortable. So I'm accepting the discomfort because I have some values that I want to act upon. I'm committed to following through with the goal of making this series of videos. So making the series of videos is in the service of some of my values, expressing myself, communicating with others, perhaps helping others, perhaps amusing others. And I'm willing to have some discomfort. I'm willing to accept some discomfort inside my body or my mind or however you want to talk about it in the service of completing this goal, which is in turn in the service of these kind of broad values that I presumably will continue to act upon for the duration of my life, and that I've acted upon in the past. That might give you a little bit of a flavor of what we mean in ACT by values, and also a little more of a flavor of why this form of therapy is called acceptance and commitment therapy. Now, I plan to tell you a whole lot more, but I think I'm going to take a break for now. You're not going to notice that, but I'm going to do it. You take care.